Right now, millions of Americans over 60 take their blood pressure pill every morning, check the cuff, and feel relieved when the numbers look perfect. The problem is that perfect target is often based on a younger body. As we age, our arteries change, our circulation changes, and the brain and kidneys may need a different pressure range to stay well supplied. Here's the uncomfortable truth. For many older adults, the real danger isn't only blood pressure that's too high, it can also be blood pressure pushed too low. And that's what makes this situation so sneaky. It usually doesn't feel dramatic. It can feel like mild morning dizziness, a bit of brain fog before coffee, or needing the handrail on the stairs for a second. Most people chalk that up to just getting older. Sometimes it isn't. This isn't about blaming patients or calling doctors wrong. It's about realizing the goal number you've been chasing may not be customized to your age, your arteries, and your body's needs. The question isn't just, what is my blood pressure? It's, what should it be for me at my age? When you're over 60, routine blood pressure checks can miss a key issue: whether your organs are still getting enough blood flow at that great-looking number. The brain, kidneys, and even the heart don't just need low pressure, they need adequate pressure to stay properly perfused. That's why some older adults run into a dangerous situation: blood pressure that's been pushed too low for their age. It doesn't always show up as a crisis. It shows up as quiet warning signs. People often ignore lightheadedness when getting out of bed, feeling slightly off balance, getting a little foggy mentally, or feeling unsteady on stairs. These can be subtle, on and off, and easy to blame on aging. Clinically, what's happening is simple to understand. Older arteries tend to be stiffer, and the body may require a certain pressure baseline to maintain steady circulation, especially when you change positions, like standing up. If medication or aggressive targets drop your pressure below what your body can comfortably support, you can end up with underperfusion. You may still have a normal reading on paper, but your day-to-day function can quietly worsen. So the goal isn't to fear medication or stop treatment. The goal is to avoid a one-size-fits-all number and start asking, is my target protecting me or overcorrecting me? Most people think the goal is simple. Get your blood pressure to 120/80 and you're safe. But for many adults over 60, that number is not automatically the best target. The real question is more specific and more medical. What blood pressure range supports your brain, kidneys, and arteries at your age? As we get older, our circulation isn't the same as it was at 40. Arteries tend to become less elastic, and the body may rely on a certain level of pressure to keep blood moving efficiently, especially to the brain. That's why two people can have the same reading on a cuff, but very different outcomes. One person feels sharp and steady. The other feels dizzy, foggy, or unsteady because their good number may be too low for their body's current physiology. So instead of chasing a generic target, the smarter approach is individualized. Your age, symptoms, fall risk, kidney function, medications, and how you feel day to day should all matter. That's not making excuses. That's how good medicine works. Bottom line, don't just ask, what's my blood pressure? Ask, what should it be for me and why? In the US, 120/80 is often treated like the gold standard, almost like a report card. But that number was never meant to be a universal best blood pressure for every age. Many guideline targets were built from large population studies, and a lot of those data heavily reflect middle-aged adults. The mistake happens when people apply the same target to a 65, 75, or 85-year-old body without adjusting for how aging changes circulation. Here's the simple physiology. As we age, arteries tend to stiffen. When arteries are less flexible, the circulatory system behaves differently. That can change how pressure translates into actual blood flow to vital organs, especially the brain. So while lowering blood pressure can reduce long-term risk for stroke and heart disease, lowering it too aggressively can create a different set of problems in older adults, like dizziness, weakness, or reduced mental clarity. That's why a perfect reading on the cuff doesn't automatically mean perfect for you. Medicine isn't supposed to be one size fits all. The best target is the one that balances protection, lowering harmful high pressure without starving organs of the pressure they need to stay well perfused. If your numbers look great, but you feel worse, that's not weakness, it's data. As we get older, arteries often become stiffer, less like a flexible hose, and more like a rigid pipe. That single change can shift your blood pressure pattern in a very predictable way. The top number systolic tends to rise, while the bottom number diastolic may stay the same or even drift lower. This creates a wider gap between the two numbers, sometimes called pulse pressure. Here's why that matters in plain English. When arteries can't expand easily, each heartbeat sends a stronger pressure wave through the system, pushing the systolic number up. But between beats, when the heart relaxes, stiff arteries don't hold pressure as smoothly, so diastolic pressure can drop. For someone over 60, this pattern isn't just a random number change. It can affect how well blood reaches important areas, especially the brain. And it also explains why aggressively lowering blood pressure without considering the bottom number can backfire. If your diastolic pressure is already low and treatment pushes it lower, you may start feeling lightheaded, foggy, or less steady. So the goal isn't just lower is better. The goal is stable circulation that matches your body's age. Most people assume blood pressure works like this. The lower you go, the safer you are. For many younger adults, that's often true. But in older adults, researchers describe something called the J-curve effect. It means risk doesn't just keep dropping as pressure drops. Instead, risk may go down until a point, then start rising again, forming a J shape. Why would that happen? A key reason is the bottom number, diastolic pressure. During diastole, when the heart relaxes, blood flow to certain tissues is supported by that baseline pressure. If diastolic pressure gets pushed too low, the body may not maintain the same level of steady perfusion. Over time, that can matter, especially for people whose arteries are already stiff with age. So the message isn't high blood pressure is fine. It's the opposite. High blood pressure still needs treatment, but treatment should be smart, not aggressive for the sake of a pretty number. In older adults, the best target is often the one that reduces long-term risk without causing symptoms like dizziness, fatigue, brain fog, or instability. If lowering your numbers makes your life feel worse, that's a red flag worth discussing. Here's the part most people never hear. Blood pressure is not just a number to win. It's the force that keeps blood reaching your brain, heart, and kidneys. In older adults, if treatment pushes pressure too low, you can end up with a reading that looks excellent, but circulation that isn't supporting you the way it should. This is especially important when the diastolic pressure, the bottom number, drops too far. That bottom number matters because it helps maintain baseline flow between heartbeats. If it gets too low, some people may notice very real day-to-day consequences: lightheadedness when standing, fatigue, feeling unsteady, or mental fog. Again, many brush it off as just aging, but sometimes it's an overly aggressive target. Your organs respond differently. Brain may get less consistent blood flow, especially when you change positions. That can feel like dizziness or fog. Heart needs steady perfusion. In some older adults, very low diastolic pressure can be a concern. Kidneys rely on adequate pressure to filter properly. Too low can be a problem in vulnerable patients. This is not a message to stop medication. It's a message to stop being passive. If your numbers got better, but you feel worse, don't be the soft, quiet person who accepts it and suffers. Bring it up. Ask whether your target should be adjusted for your age, symptoms, and fall risk. That's responsible care. A lot of people over 60 start noticing changes and immediately label them as normal aging, slower thinking, forgetfulness, feeling mentally cloudy, less sharp focus. Sometimes aging is part of it, but not always. One clinical angle that often gets overlooked is brain perfusion. Whether your brain is consistently getting enough blood flow to operate at its best. As arteries stiffen with age, circulation becomes less adaptable. Then, if blood pressure is pushed too low, especially in someone who already runs lower on the diastolic number, blood flow to the brain can become less steady, particularly when you stand up, climb stairs, or move quickly. And the scary part is how quiet it feels. It doesn't always feel like an emergency. It can feel like mild fog, subtle imbalance, or just not being as confident on your feet. This matters because falls, near falls, and chronic dizziness are not minor inconveniences. In older adults, they're a major risk multiplier. If a blood pressure plan reduces stroke risk but increases fall risk or daily dysfunction, that plan needs to be re-evaluated, not blindly followed. So don't be the person who shrugs and suffers. If brain fog or unsteadiness showed up after a medication change or a tighter BP target, treat that as a meaningful signal and bring it to your clinician. The goal is a target that protects you and keeps you functioning well. If you're over 60, there's one simple check that often matters more than a single good reading. Orthostatic blood pressure testing, measuring your pressure, lying down, then standing up. It takes about 3 minutes, and it can reveal why some people feel dizzy or foggy even when their numbers look great on paper. Here's the idea in plain terms. When you stand, gravity pulls blood downward. A healthy system tightens vessels and adjusts heart rate to keep blood flowing to the brain. But in many older adults, especially those on blood pressure meds, pressure can drop too much when standing. That drop can reduce brain perfusion for a moment, causing lightheadedness, wobbliness, blurred thinking, or that I need to grab something feeling. Clinically, a common red flag is a drop of about 20 mmHg in systolic pressure, the top number, after standing, especially if symptoms show up. That's not being weak. That's physiology, and it's fixable once you identify it. So if you've ever felt dizzy getting out of bed, unsteady on stairs, or oddly foggy after a medication change, don't just accept it. Ask your clinic to do the lying to standing test and document the change. A blood pressure plan should protect your heart and brain without increasing your fall risk. Let's make this real with a common scenario. Imagine a 1-year-old woman who used to run around 148 over 84. Her doctor adjusts her meds to hit a perfect target, and now her readings average 118 over 72. On paper, that looks like a win. The chart looks clean. Everyone feels reassured. But here's what starts happening in her real life. She wakes up a little woozy, feels mentally off in the morning, and notices she's grabbing the railing more often. She used to enjoy walking outside, but now she hesitates because she feels unsteady when she stands up. Nothing feels dramatic enough to call 911, so she assumes it's just aging. This is exactly where older adults get trapped. The numbers look better while the person feels worse. Now, the clinician does a simple orthostatic check. Measure blood pressure lying down, then standing. And it turns out her systolic pressure drops by more than 20 points when she stands. That means her brain is getting less consistent blood flow during position changes enough to cause dizziness and fog. The solution isn't stop all meds. The smarter move is to adjust the plan, review the medication list, reduce overcorrection, and aim for a target that controls risk without creating symptoms. After that change, she may land in a higher, safer range for her body, feeling steady again while still being protected. In American clinical practice, many guidelines suggest aiming for under 130 over 80 for most adults. But the key phrase is most, not every single person, especially not every person over 60. In older adults, the best target depends on how your body is functioning, not just what looks ideal on a chart. Here's how clinicians typically think about it in a simple, practical way. If you're in your 60s or early 70s, generally active, steady on your feet, and not having dizziness, faintness, or falls, a tighter goal may make sense because it can reduce long-term stroke and heart risk. But if you're older, often mid-70s and beyond, have a history of falls, feel lightheaded when standing, have frailty, or notice brain fog that worsened after medication changes, then pushing numbers too low can be the wrong trade-off. In those cases, the priority shifts to maintaining safe perfusion, keeping blood flow reliable to the brain and kidneys while still controlling hypertension. This is not making excuses or being lazy with treatment. It's evidence-based, patient-centered care. The goal is to reduce risk without creating a new risk like falls, injuries, or functional decline. So if your blood pressure is perfect, but your balance, energy, or thinking got worse, don't stay quiet. That's not you getting weak, that's your plan needing adjustment. If you're over 60 and you're managing blood pressure, don't just show up, nod politely, and walk out with the same prescription. That's how people get stuck with nice numbers and a worse quality of life. You need to advocate for your actual health, not your chart. Here are 3 simple specialist-style questions that can change the entire conversation. Can we check my blood pressure lying down and then standing? This screens for orthostatic drops that can cause dizziness, fog, and falls. It's quick and it gives real-world information your seated reading may miss. Given my age and symptoms, what blood pressure range is right for me? Don't accept one-size-fits-all targets. Ask for an individualized range that balances stroke, heart protection with stable brain and kidney perfusion. Could any of my medications be contributing to dizziness, fatigue, or brain fog? This includes blood pressure meds, but also other common meds that can amplify lightheadedness, especially when combined. And one more thing, be specific. Tell them when you feel symptoms, morning, after standing, after meals, after dose changes. Bring a simple home log if you can, especially readings taken when you feel off. This isn't being difficult, this is being smart. Weak people suffer quietly. You're not doing that. If you're over 60 or you love someone who is, don't let good numbers fool you. Take this seriously. Do this today. Write down these 3 questions and bring them to your next appointment. Can we check my blood pressure lying down and standing? What BP range is right for me at my age? Could my meds be causing dizziness or brain fog? And if this video helped you, share it with one person who's taking blood pressure meds. That one share could prevent a fall, a hospital visit, or months of silent decline. Comment below, check, if you're going to ask for the lying to standing test. Subscribe if you want simple, medically grounded health info without the fluff.